Hi guys, my name is Giovanna Lame. I am a TOU student and I'm taking medical terminology. And I'm going to give you a little bit of information about the urinary system as well as some basic terminology. So here's a couple of anatomy. The primary structures of the urinary system include the kidneys, uterus, bladder, and urethra. The two kidneys are a pair of purplish brown organs that are located below the ribs toward the middle of the back. Kidneys regulate the acid base balance and conserve fluids. The two ureters are narrow tubes that carry urine from the kidneys to the bladder. The muscles in the ureter walls continually tighten and relax, forcing urine downward away from the kidneys. We have the bladder, which is a triangular shaped hollow organ and is located in the lower abdomen. It is held in place by ligaments that are attached to other organs and the pelvic bones. The bladder's walls relax and expand to store urine and contract and flatten to empty urine through the urethra. And lastly, we have the urethra, which is a tube that allows urine to pass outside the body. Outside the body, the brain signals the bladder muscles to tighten, which squeezes urine out of the bladder. At the same time, the brain signals the sphincters muscles to relax, to let urine exit the bladder through the urethra. And when all these signals occur in the correct order, normal urination occurs. These structures of the urinary system are responsible for the formation and expulsion of urine from the body. Here we have a little bit of physiology. So the urinary system function is to filter blood and create urine as a waste byproduct. The kidneys and urinary system help the body to eliminate liquid waste called urea and to keep chemicals such as potassium and sodium and water in balance. Here's a little bit of terminology. This is a list of root words with their combining values for the urinary system. So the more basic ones on this list are cysto, which means bladder or sac, nephro, meaning kidney, reno, meaning kidney as well. We have uro, meaning urine. We also have urino, meaning urine. We have utero, meaning uterer, urethro, meaning urethra, and visco, meaning urinary bladder. This is some terminology continued. These are urinary specific suffixes and prefixes. And the most common ones on this list are ante, meaning before, and as just mentioned, cis, meaning bladder or sac, noct, meaning night, poly, meaning much or many, again, reno, meaning kidneys, and ura, meaning urine condition. So here are some urinary specialties. So we have nephrology, nephrologist, urology, and urologist. And to break down these words, for nephrology, nephro means kidney, logy means the study of, and altogether this word means, what this word is the study of the anatomy and physiology of the kidney. And for neurologist, the breakdown, nephro means kidney, logist means the one who studies, and together it means a physician specializing in the conditions such as kidney disease, renal failure, dialysis patients, and renal transplants. Next, we have urology. For the breakdown, uro means urine, logy means the study of, and what this is the study of the anatomy and physiology of the urinary tract and the male and female reproductive system. And last, we have urologist. Again, uro meaning urine, and logist meaning the one who studies, and altogether meaning a physician specializing in the treatment of the male and female urinary tract and reproductive system. And lastly, the urinary system overall healthcare functions to remove waste products and drugs from the body, balance the body's fluids, release hormones to regulate pressure, and control production of red blood cells. And that was the end of my PowerPoint. Thank you for watching and hope you enjoyed.